Hello, good afternoon. My name is Bess Howard, and I'm with Wellness Revolution Clinic. We're in Cleveland, Tennessee, and we're going to have a B3 Symposium number 2 today. This is all about hunting and some testimonial from one of my clients today. So today I want to introduce you to myself. This is my clinic where I'm from. My secretary's name is Tracy. This is Tracy. She's been with me 3 years now and put up with me, and she's the soul of this place. Very good woman. I've written a book called 50 Ways to Crazy. You can find that on Amazon. It's basically there's 50 chapters there on all the reasons that you can feel like you're mentally ill or have problems with your brain. It's a very well done book. It took me 4 years to write it, so it won't take you 4 years to read it, though, I promise. Each chapter is self-contained, and so you can read a chapter at a time and digest it and go through all of the websites that I suggest and all of the supplements that I give my own patients. I think you'd like it very much. Today we're going to be talking about how the hunters can be hunted. So hunters often go out, they're prepped for hunting the animals, but are they actually prepped for staying safe? And so that's what we're going to talk about today. This particular man, he's all garbed up, but and the dog is ready. You can see that, but are they actually prepared for a tick bite? Are they prepared for mosquito bites or ant bites or chiggers or anything of that sort? And then are they actually prepared not to get blood on their clothing or in aerosolized blood that gets into the lung or to the eyes? Are they prepared for those kinds of things? So that's what we're going to talk about today. So how can a person be exposed? Well, there's tick bites, mosquito bites, horse flies, flies of any kind, spiders, chiggers, and fleas. And of course, there's probably more than that, but that's all I could think of at the main time. But now, when you talk about the animals and their blood is infected, here you are with a knife. You make your kill. Here you are with a knife, and you're cutting these animals open, and you're getting that blood on your hands. So I have a guy that came to see me when I was first starting to practice here, and he had low white count and low platelets, and he seemed okay, but there was this low platelet count, and so he went to Vanderbilt several times a year to find out why he had low platelets, and they could never tell him why. So I said, "What do you do for a living?" He said, "I'm a salesman." I said, "Well, what do you do for fun?" He said, "I hunt." I said, "Is that right?" I said, Do you hunt and kill those animals and skin them without gloves on?" And he says, "Yes." And I said, "Don't do that anymore. Don't do that again. I believe you probably have some type of Rocky Mountain Ehrlichia, something in that category." So your dogs are also at risk for tick bites and the flea bites and all of those kinds of things. So not only do deers carry this Ehrlichia, Rocky Mountain spotted fever, anaplasma, those kinds of things can cause their own problems. They carry Lyme disease, which is Borrelia. They carry multiple types of viruses, this heartland virus and Powassan, and then Babesia and Bartonella. So on Ehrlichia, Rocky Mountain and spotted fever, heartland, the heartland virus, and anaplasma, they all cause fever, low white count, low platelets, and high AST and ALT. Those are liver functions tests, and Bell's palsy. You see a lot of farmers that have this kind of thing go on. And of course, when you have Bell's palsy, they work through another way of treating it. They don't treat you for Lyme. They give you another type of drug to help that pain. When you look at Lyme disease, you have migrating joint pain, headache, fatigue, brain fog. You can also have Bell's palsy, and then you have intermittent burning in the extremities. Babesia, you can often have gait issues. The primary symptoms are shortness of breath, day sweats, night sweats, chills, anxiety. Bartonella can cause eye issues. It can cause your teeth to fall out. You can have tremendously high swollen lymph nodes, sore foot pads, like I said, infected teeth, infected bones. Psychosis, and POTS it's a postural orthostatic hypotension. In other words, you stand up and you fall down because all of your blood just runs down to your feet. So that doesn't normally happen with healthy individuals. And then some of these viral conditions. See, you could have this. You could have a fever, headache, vomiting, and this is all a part of a Lyme-type illness. And just think it's something that goes away pretty fast. But all of a sudden, you have seizures and speech issues. You know it's a problem that's not going to go away. All right, so I've just found a few interesting articles on the internet about Lyme. There was this tularemia, rabbit fever, leptospirosis. This is all emerging things that are happening in Europe. And these things happen as a result of infected live or dead birds. The fact is, when people talk about their pets, and these are wild animals, but pets can do the same thing. You get their saliva on your skin, they lick you. Cat scratch fever is feces under the nails of a cat, and the cat scratches you, and that embeds into your skin. So there's all kind of ways to be contaminated with these things. Just imagine, you've gone through the woods with briars and thorns, and you're all, you cut up a little bit, and then you decide to, cut up an animal. You get that blood right on a cut. It's going to go right through your skin. So, yes, you can get it by infected live or dead animals or birds. You can get it vector-borne, any kind of flying insect. You can get it by contact with contaminated water, soil, urine, saliva, and blood. You can also get it through dust. I have one patient. She has a little business in the spring where she has she pots plants and sells them. And this has happened to her twice now. Her hair falls out in the spring. And I said, it's got to be something that is in that dirt. There's something about this. It doesn't happen any other time of year. It's something about what you're doing. So we're looking at it a little bit more carefully now. Alrighty? Okay, so this is a big deal, exposure to blood. So here's 3 men. Of course, they're from up north, and these men butcher deer. So they had butchered more than 250 deer carcasses over 2 weekends. But they had not worn gloves, masks, or protective gear for their eyes. And of course, they had numerous cuts on their fingers and hands from the knives. And, bony, sharp fragments and all of that. One patient has stabbed himself in the thigh. So anyway, and then, of course, they often use electric saws, and that vaporizes the blood, and it gets, into your eyes. It can get into your clothing, and that is not good. Here's a story about ocular toxoplasmosis. Again, you have floaters, blurred vision, and blindness. It can lead to blindness. It doesn't cause it immediately, but if it's not treated, it can. See, and I'm one of the people that never go to the doctor. I'm Pollyanna. I never think anything is ever wrong with me, so I'm the one crawling into the doctor's office. And so I'm so glad I'm a clinician. I can treat myself, mainly. But I would probably be the first person to think there's nothing wrong with me, that my eyes are bothering me, but it's probably nothing. And so this is a severe eye infection. It can actually cause blindness. And they ate uncooked meat, and then they were cleaning the animals. And if I were a hunter, I would have an electric saw or some kind of a saw where I didn't have to do all that work. So this makes perfect sense. All right, so what we would like for people to do is to be more careful. So we want you to wear gloves and eye shields, protective clothing. We want you to avoid animal blood, body fluids to the hands, skin, and eyes. You probably need to wear a mask. Avoid insect bites. So you tuck your pants into your socks, your shoes, your socks, and then you duct tape those things. So, nothing's going to crawl up your legs. And then, however you've got to do it, keep yourself safe, do that. And you can use that DEET and permethrin, cook your meat thoroughly, and, ivermectin is readily available on the internet. You could consider that, just taking ivermectin before you went out on a hunt. I think that would be an excellent idea, because there are studies where ivermectin actually kills. I don't know who they had do it, but they had people that ticks were on their bodies, and the ticks actually died from the ivermectin that they were taking. So it's a real possibility that would be helpful. So I in the past few years, I have noticed that I have to treat my patients with ivermectin because all of my Lyme patients have multiple viral infections. And this is another way that people are not getting well. So we know that ivermectin, the effect of it is increased by zinc. We know it kills COVID. And these are the following viruses that it kills. It kills herpes. It also kills Epstein-Barr, which is not on there, but it kills Epstein-Barr and West Nile and all of these types of viruses. It kills the bird flu, several types of things like that. You can see that you can have equine herpes as well. And pseudorabies. Some of these actually come from animals, and that flavivirus, that Powassan virus is a flavivirus. So this is just all interesting, but ivermectin will kill all of this. Now, I want to introduce you to one of my very dear clients. She has been with me for 1 year, and she's going to tell you a little bit about her story. So come and introduce yourself.
Hi, my name's Hannah.
Okay, so like I said, Hannah's been with me for about 1 year, and so tell them a little bit about what your life was like before you came here, and tell them how long you had been ill, and everything about that.
When I was 11 years old, I started having symptoms of anxiety, and I just didn't feel well. I was sick to my stomach, and I would go to the doctor, and they would say, well, you have acid reflux, but not the normal type of acid reflux. And it was kind of something that I just got adjusted to. I thought everybody didn't feel well. I played softball, and I would do a whole weekend tournament, and I just thought all the girls on the team felt sick and tired more than what would be normal. But when I was 15 years old, I started having very bad pain that started in my stomach and just kind of spread to my body to where I couldn't go to school anymore. So at 15 years old, I was not able to go to school. I spent all my time at the doctor's, and no one could find anything wrong with me. They removed my gallbladder, and I had doctors who, after running the tests that they knew to run, I was told that I was crazy, that I was, by that time, a 16-year-old girl who would grow out of it. I was looking for attention, and I was sent to a psychologist. And a year and a half into being bedridden, we ran into some family friends who said that their son struggled with similar symptoms and that he has Lyme disease, and they recommended a holistic doctor. And that's when I was diagnosed with Lyme disease. But still, that began a whole many years of trying treatments, nothing working, feeling sicker, nothing helping, feeling hopeless, and until I found Dr. Bess.
I have nagged her into being well. I promise you have. I've been so mean to this girl. Oh, me. So, okay, let's kind of talk about what some of your symptoms were. Can you go to the next slide? All right, next. So one of the reasons why Hannah was so sick was obviously these bugs entered her body. These bugs entered her body and replicated tremendously in her body. And you know, one of the things that you see, I have another patient here who has an illness where he has ulcerated ulcers all over his body, ulcerated arms and all through his body. And I was looking at a slide yesterday that showed how the biofilm can intermingle with the tendons and the skin. And you have this tremendous mess going on. So no wonder she was sick, and no wonder she could not get well. Okay, so she had biofilm. So this is a slimy coating that covers these organisms. They make this coating, and it's a 3D coating. They make it over it so that, you know, so that then you're trying to take an antibiotic or something that's going to get through that coating. I don't think so. That's not going to happen. So that's why IV drugs don't work very well, because someone's got to cut through this biofilm, and you've got to find something that does. So go right ahead. Okay, so what on here did you find that you had? So these Lyme-type illnesses cause hormone dysregulation. So we know that these microbes, they cross a blood-brain barrier. They eat their way up into your brain through your blood vessels. They lay down biofilm, and they lay down they lay down biofilm while they're eating up the collagen. So then you have sluggish blood flow going into your brain and sluggish going out. So that's why you have such an issue with your cognition. Did you feel like you had a really bad issue with your brain? Speak up.
Yes, very much.
When I tease her about when she first came to see me, and I tell her all the time now, I said, I'm taking a video of all these people coming in here because, you know, they're in here coming in dragging a leg, or, you know, they look so terrible. But Hannah could barely understand me. She could barely, you can see obviously how bright she is. She reads everything. She's a very articulate. But when she first came in here, she was just sitting across the table from me trying to understand what I was saying. You know, the simple questions. She just was so sick. So she had heart racing. Did you have sleep issues?
Yeah.
Sleep issues. You definitely had POTS. That's one of the symptoms of Bartonella. When you stand up, like I said, you get very dizzy. Your heart races. Your heart rate goes really high. Your blood pressure goes really low, and you almost faint when you stand up. So, and you have a lot of dysregulation of that whole system. You know, think about autonomic as automatic. So your automatic nervous system does not work anymore. Everything is jammed up and jacked up. So you have a tremendous amount of inflammation going on, and in your central brain, and shuts down a lot of hormonal cascade. Now, one thing about Hannah is, and everybody that comes in here that has Lyme, they also have immunosuppression. So that means that these Lyme bugs have not only gotten their way into their body, they have made it so that your body cannot kill them. So you end up with all kinds of infections, not just a bacterial infection. You have a parasitic infection, yeast, bacterial, viral, and then you have this autoimmune. Did I tell you that you had an autoimmune issue too? I can't remember.
Me neither.
Oh, that's all right. Go right ahead to the next slide. Okay. So on Borrelia, this is general Lyme disease. People will have dizziness, low blood pressure. Sometimes they have a relapsing fever. This is a particular one called Borrelia miyamotoi. They can have a high heart rate, muscle and joint pain. A lot of times it's traveling muscle and joint pains, belly pain, peripheral vision issues, floaters, anxiety, and a lot of people will get an allergy to red meat, and that's called an alpha-gal. Now, this can be tested for. You need to ask your doctor if they can test you for alpha-gal. If you have alpha-gal, I would say you probably need to be treated for Lyme disease. So when we treat Borrelia or Lyme disease, we use methylene blue. It depends on how I treat this. When patients come in on psych drugs, we usually start them on methylene blue and then cycle them off their psych drugs as we can. Doxycycline is an excellent drug, but it causes a lot of sun sensitivity. You can get burned really bad quickly. Tinidazole, excellent. And nitazoxanide is an anti-parasitic, and I use antifungals and ivermectin. So you understand that no one has one thing. It's just impossible to say that, and because testing is so poor, I think it would be wise to be treated for multiple things. So here's Bartonella. Now, they often call that cat scratch fever. You have intermittent fevers. The swollen lymph nodes are horrendous. A lot of times they're right around in the cervical area, around your neck. A lot of sore throats, excuse me. A lot of dental abscesses, a lot of blurred vision, confusion. You can have real panic disorder, real seizures, and almost a type of onset of schizophrenia. Bad psychosis, delusions, suicidal ideation, all of this comes from Bartonella. And so something that taught me, something is always teaching me here. And it's usually my patients are teaching me something. So I think I had talked about it in the last clip, but I had a patient who was about 10 years old, treated him for Lyme disease, and he got well. And he's been playing tennis. He's like the star of the tennis team. He does very well. But he had to have his wisdom teeth taken out. And when he did, the wisdom teeth had not even come through the gum. They were inside the gum. They were all infected, all of them, which I find very scary. And so when he had those excised, then his lips swole up, gigantic, and he had all this infection going on. Even though they had treated it with clindamycin, which is normal to be treated for with dental abscesses and things. So I treated him with clarithromycin and rifampin and an antifungal, and he got well. But I told his mother, I said, you need to keep him on this for a while because he had this underlying condition. I didn't know anything about it. And that could actually ruin his teeth. So not only does it get into the teeth, it actually gets into the bone. It can form abscesses in the bone. So this is something you don't want to mess with, and that's why we treat for it. I treat every Lyme patient for this. Go right next. So how we treat that is with, go ahead, clarithromycin. This is Dr. Mosiani and Dr. Bretschwert, their information, and they treat it with clarithromycin and rifampin. And I was just listening to Dr. Horowitz say that if a child is under 8 years old and you don't want to give them doxycycline in case it might stain their teeth, you can give them rifampin. And we always take our rifampin at night because it makes you tired, right? Mm-hmm. Yep. Okay, so we've learned a few things. Next. All right, so this is Hannah's treatment plan. So this is what we did with her. We put her on clarithromycin, 500 milligrams twice a day, and rifampin. She took two 300 milligram tabs at bedtime. She took nystatin, which is an antifungal, 2 tabs twice a day. We started her on methylene blue at 10 milligrams, and we increased that slowly until she could get to 40 milligrams twice a day. And the nitazoxanide, that's an antiparasitic, but it also kills Lyme. It kills some Babesia. It kills a lot of things, but it doesn't kill Bartonella. But I love that product. And then ivermectin, we had that compounded, and she took 1 capsule 6 days a month for 6 months. How did you feel about this treatment, Hannah? Was that doable to you? You know, so many people are afraid of taking antibiotics. And so you were afraid too.
I was. When I first got diagnosed with Lyme disease, it was like a complete 180 from everything that I thought I knew about medicine, and they were all supplements and very natural, and they changed my diet completely to the point where I was afraid of everything that I had known. But that was when I was 16, 17. I'm 24 now, and I've been coming here for a year, and I was scared, but I was doing these alongside of supplements, and I had been on the supplements for a little bit beforehand. And I think the biggest...
Well, we're going to go over the supplements in a minute, but tell them that you can do this. Like, yeah. I mean, she was literally looking at me across the table like, I've tried that. I've done that. That doesn't work. No. I'm like, give me a chance here, Hannah. We just met. Give me a chance here. And so she said, okay, I will. And so I don't think it was easy for you, was it?
No, I was nervous, but it's been so long that you've got to try or you'll just stay where you are.
Right. So this is a doable thing. And so with the addition of the supplements that you're taking, you're saying that you can fix the nausea, fix your belly pain, and fix any kind of herxing that you're going to have. Did you feel like you did a lot of herxing? You had a lot of flu-like symptoms?
I didn't experience herxing for the first or second time in all of my treatments that I'd done. I would say one of the very important things is detoxing. That's something that I've learned the 3 times in the 8.5 years that I've had any positive reaction to treatment is when I was detoxing as well. Okay,
excellent. Well, so go to the next slide. We'll talk about our detox therapies here. So one of our first detox therapies is this foot bath. Go to the next one. I think it might be on that. The Ion Cleanse foot bath. And now Hannah comes and does... We have a beamer mat. It's a pulsed electromagnetic field light, and that increases blood flow throughout your body. And she's on that for about 20 minutes, and then she goes to have a foot bath for about half an hour.
Twice a week.
And tell them about that. Well, I mean, it does make your brain feel better, doesn't it?
Yes, I definitely notice a difference when I miss a detox foot bath. I'll start feeling sluggish and tired. And a few slides ago, there was the cystis tea. Mm-hmm. When I was in the thick of the treatments, I'm not on all of these treatments anymore, but when I was taking all of them, I would drink the tea and I would feel so much better, and then I'd get lazy and I wouldn't drink the tea, and I started feeling nauseous and tired, and I just know I could feel the treatments affecting me, and then I would drink the tea and I would start feeling better again. So I definitely noticed an improvement when I took it, and that's what motivated me to keep taking it.
So we also gave her this Toxys. This is by these two products are by Beyond Balance. She took the Toxys with her antibiotics, and she kept this in her purse. Anytime she felt bad, she just took 5 to 15 drops of that.
I would do just a whole dropper, and I was taking that daily, and now I just take it whenever I need it, which is not that often.
Mm-hmm. And then the complement to that is this is a capsule, this Toxys 2. So really and truly, you can take antibiotics and not be sick and not hurts and not be too ill by doing these detox therapies. So go back to the previous slide there. Okay, so we started lumbar kinase. I am so careful. I know it sounds like I'm just a bull in a china shop and I'm just going to try anything. That's not true, is it? It just sounds like it. She often asks me if I'm her. I'll want to try something with her, and she said to me the other day, she said, "Has anybody else tried this? Am I your first one?" I'm like, "You are not my only guinea pig. I would like to let you know that. You're not my only one." So, but we tried this lumbar kinase, which thins the blood and helps it. What we were intending for it to do is for it to get better blood flow to her brain. And wow, that stuff was amazing, wasn't it?
Yeah.
This is the only brand I use, but that doesn't mean others are not better. It's just when I find something that works, I usually stick with it. So you started with one, and then what did you do?
Well, I started taking it because I had mentioned that when the weather changes, like there's a storm coming, like I could tell you 3 days before a storm is coming, and because my head would just hurt so bad that I couldn't get out of bed. And so I told her that, and after she finished laughing at me, she recommended the lumbar kinase, and now it's crazy how amazing that pill has helped me. I wouldn't be able to get out of bed for days during a storm, and now maybe I get a headache. Maybe I can tell you that there's a storm coming, but I can still continue through my day.
Mm-hmm.
And I take one every day. I take 2 if I notice that my headache's worse, and I'll take 3 if I'm really being affected. But I would be cautious with 3 because that's when my nose started bleeding.
So she also takes extra vitamin C just to kind of ward off any nosebleeds. Now, the Cistus tea is the tea that she was talking about, this detox tea. And so not only does it help with, toxins, it really helps with pain. I've noticed that one of my patients was saying that it helped him with his nerve pain. So this stuff is great. It's well worth doing, and you should do it. And then
Isn't it a biofilm buster as well?
So all of these are biofilm busters. This BFM1 by Beyond Balance, they take one of those twice a day. They take the Cistus tea. They make it up. It can be loose or tea bags, but it's simmered for 15 minutes, and then you can put it with stevia and drink it all day long. All right, here's something else. Tell them about this sodium butyrate, Hannah.
I love that pill. When I first got diagnosed with Lyme, they basically told me to stop eating everything. That's what it felt like, and so that's what I did. And it got to the point where there was 3 things that I was able to eat, and it was like chicken with like nothing on it, broccoli, and rice, and even that would make me sick. And I start adding things in, and I would get headaches, I would get stomach pain. I couldn't eat anything. It felt very hopeless. And when I started taking this, I can eat anything that I want now. I stay off gluten and I don't have beef, but it's amazing the freedom being able to eat again.
And she was not positive for alpha gal. I tested her for that, but isn't that interesting that she still reacted to beef? It felt like it made her throat close up. So that's why she still doesn't eat it. But at some point she can try that again at some late date. And then we use a lot of these BioPure products. This is chlorella and cilantro. So what this does, the cilantro helps you make bile acids, and the chlorella binds with the toxin and helps pull it out into the GI tract and through the colon and out. And so we love these products. This CGF chlorella is a concentrated formula. One capsule is worth 20 chlorella tablets, and it's in a form that doesn't really hurt your stomach. Sometimes chlorella can hurt your stomach because of the cell walls are hard to digest. So this is already in a digestible form, and we really like these products. All right, so she did 6 months of all that I had mentioned before: clarithromycin, and rifampin. She did Alinea. She did the methylene blue, and she was on the ivermectin, and she was on all those other supplements, and she was doing pretty good. So one day I said to her, I said, Hannah, you need to start making some plans for your life. And she just looked at me like I was from outer space. I said, you're going to get well, darling. You need to make some plans. And so she came the next couple of weeks. First she said, I never really thought I was ever going to get well. And you really felt like that, didn't you? Then now she's, tell them what you're doing now as opposed to what you were doing last year.
So now I work at a preschool. It's the most fun job,
Mm-hmm.
and I work full days every day of the week, which is just surreal to believe, and it's amazing, and it feels wonderful.
And then you're driving?
Oh yes, I'm driving, I'm eating, I'm working, I'm
Acting like a normal 24-year-old, aren't
Yeah.
you? That's amazing. And so I heard about this double dapsone from Dr. Horowitz, who's world-renowned, and what happened with this was somebody was taking this wrong, and they got a little sick, and they called him and they said, Dr. Horowitz, I'm so sick. And he said, well, what are you taking? And they were taking too much dapsone, and he says, well, come in next week, I want to examine you. And they were so much better. So we decided to try this. But now dapsone has its own set of little issues. Number one, it can cause hemolytic anemia. It can cause your red blood cells to burst, and you have a real problem with that. So we did things to keep that from happening. One is we gave her extra methylfolate, and she took leucovorin, which is also a type of a B vitamin. She took high doses of leucovorin and high doses of methylfolate, 15 milligrams, so that's 30 milligrams a day. And then she took the dapsone, the 100 milligram, 2 tabs twice a day for 8 days. And she also took the rifampin at night, and she took the doxy. So this was a little bit horrific, wasn't it, the first time you did it?
Yeah.
So tell them about how that happened.
Well, I'll be honest, it was not a fun week. I had scheduled this, I had time off, it was the perfect week to do it, and I kind of went in knowing that it could be rough. And 1 hour into taking the first pill, I was gripping the chair because I was so dizzy, and then I spent the next 8-9 days in bed, unable to move, terrible migraine, couldn't even. It was not a fun week, but it was so worth it. I've noticed such big improvement just since taking that, and I'm even wanting to take it again, which is.
Yeah. So her mother, the week, the day or two after she took it, her mom said, I don't think you're going to get her to do that again. And so about a week later from that, Hannah's looking at me, she's like, you have no idea, my brain is so good. Oh my goodness, my brain is so good. And so she got so much better. Now she wants to do it again. So I suggested we wait 3 months. And so you're not on much of anything right now, are you?
No, not on much.
So I am going to put Hannah on a Mepron treatment for Babesia, just in case she has it. I probably will never know what she actually had. But what we do know is she's tremendously better. So why we did this dapsone treatment is because there are such things as something called persisters. Like you get, like I said, all of this stuff is embedded in your muscles, your tendons, your bones. It's in your teeth. It's in your skin. It's in your heart muscle. Listen, your heart is a muscle. This can cause Lyme carditis. You know, people. That's probably one of the reasons why people are so sick and so tired. And so we tried this treatment for 8 days, and it was amazing. But it must have potentiated that methylene blue because she turned blue. Didn't you?
Yeah.
We called her a Smurf for that week. Actually, the methylene blue is a protectant against dapsone. But what dapsone is actually given for is leprosy and spider bites, bad spider bites, and things like that. So it's quite a drug, but you have to be very careful with dapsone. Go right ahead. So here's our babesia. Like I said, a lot of this is intracellular. It's inside your blood cells, and this is very scary. These are your red blood cells. So anyhow, this is not just. Listen, we're not talking about the fact that you're sick for a day or two. You're sick with this. In fact, one of the questions that was asked to me was, so you get sick and you get on, your doctor gives you a 7-day treatment of doxycycline. Well, I'm sorry, I just think that's a terrible idea because you've already started biofilm. I mean, how are you going to clear up the biofilm? What about any other bloodborne co-infections that you've got? What about babesia? What about Bartonella? What about all the things that can, transpire? What about, the viral infections and it's good to initially stop it, but this bug, it replicates every 4 weeks, these bugs. So you can think you're well, you can look relatively well, and then you can get sick all over again because these bugs, they re-replicate. So that's the reason why we did a 6-month treatment, because we did 6 replications of these bugs for her, right? We went through 6 replications. Okay, go to the next. So babesia is just famous for can't breathe, air hunger, shortness of breath. People that they have such, you listen to someone talk and they don't hardly have any breath to breathe out of their mouth, like they're all of a sudden they can't sing anymore, they could barely speak. That's babesia. They have headaches, fatigue, panic attacks. Now, you can have some of this, and what I'm seeing in this is a lot of gait instability, a lot of spinal cord stuff, central nervous pathologies, retinal issues, a lot of eye infections and problems like that. And I hadn't put it on here, but there are some products called BPC 157 and KVP. Both of these are peptide eye drops that I use with my patients that have any kind of eye disorder. And whether it's dry eye or anything like that, it works very well. But the night sweats, day sweats, headaches, and air hunger, and that fatigue are the main things. And the pallor that just people are white, they're just pale, they just look like paste. A lot of times you'll see that. So you can use azithromycin or you can use clarithromycin, which a lot of my patients like clarithromycin. Once they're on it already, they don't want to change it because they know that they can take it. And which I think is so interesting. Itraconazole is great for sinus-type infections. It works very well up in the upper area of your lungs and your sinuses. Mepron is also called atovaquone. We call this Spider-Man serum because it's a funny color of yellow. Doesn't actually taste too bad. So people take 5 mils twice a day, and we give that with methylene blue and this cryptolepis. Cryptolepis tastes terrible. There's no other way to say it. People, they say they put it in their sister's tea. What do you put it in?
Which one is it?
Cryptolepis, that stuff that was so terrible.
Oh, I mean, I just took it, but it was awful.
So, and then the ivermectin. So we give, like I said, we give ivermectin because we don't know what virus you've got. We just know that a lot of people test positive for Epstein-Barr with all of these kinds of illnesses. And you can see some of those other, the Heartland and the Powassan. There's some type of mosquito in Florida now that causes a babesia type of problem, a malaria type of issue. Okay, so why is it that a person would not get well? Hannah, go ahead and talk about that. They didn't, no one treated their biofilm.
Oh, yeah, that's one of the important things I've learned is that the Lyme has a shield around it that all the medicine, you can take all the medicine and it's not going to actually do anything to the Lyme because of the film that it has around it. So you have to break that down first, which is the cystis T is one of those that I really loved.
Right. And then the treatment program is too short. So those bugs replicate how many times? Every 4 weeks, right? So they replicate every 4 weeks. And so you just thought you got well if you take a 10-day course of something. And that's probably what happened to you as well. You had too short of a treatment, and it didn't do you any good. And then no hormone imbalance. We treat a lot of hormone dysfunction here, and especially with our Lyme patients. I've even given you thyroid medicine at your young age, right?
Yeah.
And why?
Because I needed it.
You needed it. You were tired. So, and then, don't be moved by ads for a quick fix because that's just not true. I have a lady that in my practice, she was treated in California with all kinds of, and she spent a lot of money, more than $50,000 on all kinds of treatments. She had, the latest and greatest of everything. And then she came to see me, and then she still had to take antibiotics to get well. She still had to take clarithromycin, rifampin, methylene blue. She still had to take nitazoxanide and ivermectin and antifungals, and she's now being treated for babesia. You see what I'm saying? So I wished all of those specialized treatments worked. I wish they did, because then we could, add that to our arsenal of wonderful things that worked, but they don't. I'm sorry that they just don't work. So, going it on your own, probably not a good idea either. So is it a mixed infection? Of course it is. Of course it's a mixed infection. Did you get reinfected? Did you get scratched by your cat again, or the dog's licking you in the face, or, whatever. That, we talk about all of these things, even though they're a little unpleasant. Nobody wants to get rid of their dogs and cats. But I did talk to the lady that owns Beyond Balance about that. I'm like, look, ain't nobody going to get rid of their cat or dog, so what are we going to do about it? She says, well, actually, I'm talking to a veterinarian about working, I said, can you give, these herbal supplements to cats and dogs? She said, yes. You can put a couple of drops in their water. But I can't, I've never done that, so I can't tell you what that would actually do to them as far as if it would make them sick or not. It would make them well, but initially what it would do to them, I don't know. But if you started with one drop in the water, probably it would be fine. So this is a little bit about our Lyme treatment program. Number one, it's for 1 year. We do initial labs, and then we usually do labs again in 6 months or so. Sometimes I take little labs just to make sure your kidneys are good, your CBC, a BMP. I have a patient right now who came in with Hashimoto's, but he had instead of having low thyroid function, he had very high thyroid function. So we've been actually taking him off of a medication so we've been, taking his thyroid numbers, and he's much better. He's much better after 2 months of treatment. So the point is, he had Lyme disease, and that was driving his hyperthyroidism, which he was on a medication for. So now that he's getting better from the Lyme disease, he doesn't need as much of the other medication. So we've been taking him off of it as we can. But so the program is $1,800. It includes all your office visits and the labs that we want to do. And then we educate you, we nag you, we ask you tons of questions, and we keep up with you, and we listen to your complaints. But what we try to do is give you a full program so that you won't be sick. That's the whole point of doing it this way, and having the supplementation that goes with it, because they're not just supplements you buy from me or buy anywhere. You're taking those supplements for a good reason. And we've enjoyed, we don't add too many things because people don't like to take a lot of stuff. But the other day I had a patient come in, and he had pages and pages of things that he did, and I felt much better about our program after that. These are some just some resources that you can use. Galaxy Labs is Dr. Mosiani. He's quite brilliant. This is my company, where you can call Tracy, my secretary. Hygienics Boot Camp, that tells you all about their testing protocols. And if you have Medicare, if you're old enough to have Medicare and you have Part B, you can pay $200, and Medicare will pick up the rest of that hygienics for you, which is over $2,000. So that's a very good thing to know. Sometimes you feel like you're in the thick of things with Lyme disease, and you don't feel like you're going to get better or ever get well, but you will. You will get better, and you will get well. Thank you so much for the time with you today.